Let's do that. Sorry.
Okay.
We should give out the
So we just wanted to
first.
give out some resources about like what's, what you could look for help or anything like that during this time of, with COVID-19, just to know what's going on. And there's the emotional support line, which is the number is 844-863-9314. And basically it's a mental health services. If you have anxiety, depression, or anything like that, you could call them and ask for help, and they'll help you and they'll talk to you. I haven't talked to them, so I don't know how it is. So I wouldn't personally know, but yeah, I've given that number to like another person who had anxiety issues and just wanted to talk to somebody. So definitely call them to talk to them. In our neighborhood, there's the Henry Street Helpline. They do Meals on Wheels, and they help with also medical services as well. They're open from 8 a.m. to 8 p.m. The number is 347-493-2787. There's also the Child Abuse Hotline, which is 1-800-342-3720. Because everybody has to stay in, and a lot of these kids are staying in abusive homes. So there's also the U.S. number, which is the 1-800-422-4453, and then you call them or you text them 1-800-422-4453, which is the text number, and then the childhelphotline.org is where you can see the information on how to contact them and stuff, and check online as well if you have the internet. The Child Abuse Hotline, the 1-800-342-3720 is the New York one. Just giving it out there. So yeah, those were just like right. It was on my phone.
It's okay, because we're gonna list all any services that you might need down below. So
I'm just looking at my phone.
Don't
Sorry,
stress it out. But I do want to mention one other.
I got it. Hold up.
Other resource because this is also a resource for any immigrants who might need some resources or need to understand what's going on right now as far as going to the hospital and all that. So if you're an immigrant and if you feel symptoms which you should seek medical attention. There are emergency warning signs that I'm going to just really quickly mention: trouble breathing, persistent pain or pressure in the chest, blushed lips or face, So look at the link that we have below. It's the CDC website. It tells you everything you need to know if you're sick. Hey, Harry just checked in.
Yay!
Nice to have you here. And so please, if you're an immigrant and you have these severe symptoms or you're not sure, just, call your hospital, call your local hospital, call 311, or connect with Make the Road. Make the Road is an organization that serves working class as well as immigrants in the Bronx. They can connect you probably to any other organization locally in your neighborhood if they can, or they'll service you themselves. So please seek medical attention. We have been hearing alarming news about Blacks and Latinos being severely impacted by this virus. Due to the fact that there's not a lot of resources for our communities, right? The hospitals don't have enough resources. We don't have masks. We don't have a lot of resources. So it's important.
Oh, sorry.
Hey, ASMR. Hey, ASMR.
Sorry, we're talking about so. Sorry.
So please seek medical attention. Call first if you feel like it. A lot of people have been dying in their homes, and a lot of them have been Black and brown communities, especially in NYCHA. Especially in NYCHA.
I read an article.
And immigrants too, because they're too afraid to go to the hospitals because they can't pay for the bill. Just go. They're not going to charge you. They're not going to ask for your status. They're not going to charge you at the door immediately. They're going to service you. So I'm hoping that once this is all over, the government is going to be paying for everybody's medical bill, because that's what they need to be doing.
I mean,
but especially for people who don't have the resources to do it. Now, those people anyone who doesn't have medical or health insurance. So
it's medical racism, basically.
Yeah. So
and
please,
it happens a lot, especially in the Black communities and
seek out
Latino
help.
communities.
Oh, Mr. White Show! If you haven't seen the Mr. White Show, please look him up on YouTube. That's my friend Glenn. Peace.
Yeah.
Good to see you. So yeah,
that article you put up on Facebook about the people dying in their apartments in NYCHA, that was, I forgot the name of the article. And
we'll link it below.
But we'll link it below.
It was very scary.
It was terrifying how people would just, the way they knew that their neighbors, the mom, the son,
a mom and son died in an apartment,
was because they smelled it. They smelled their bodies. Like, it is awful what's going on, and it's
so yeah. So I mean, we tell you these are things. If you're not an immigrant, undocumented, or just if you know someone who is, please share the information.
Yeah.
So thank you.
And Andrew Cuomo, hello.
Andrew Cuomo.
The fact that he doesn't want to do the funds for immigrants, like California, I think it was the governor or the mayor, I forgot. Oh my God, I just was reading an article. I was reading a lot of articles about how they were gonna fund the immigrants undocumented because the stimulus checks don't go to them, even though they pay taxes, some of them.
And Cuomo said no, right?
And they're going to do a stimulus plan for them in California, but Andrew Cuomo, of course, said no. They're not going to do that here.
I was like, of New York.
That guy is awful.
We like a sanctuary city? Like that don't
crazy.
Make no sense to me. What is wrong? And New York doesn't want to give more funding to NYCHA, which NYCHA is really going to need a lot more funding because let's be real. A lot of these frontline workers are coming from NYCHA.
A lot of these essential workers.
A lot. So they can't pay their rent. So NYCHA is going to need money. So
and let's be honest, they're not really cleaning
NYCHA is
the
the public housing here in New York City.
Yeah, you don't know what NYCHA is. They're not cleaning the buildings a lot here. And I feel bad because a lot of the workers here who are NYCHA workers, they're trying their best, but they don't have the resources either.
Yeah.
And so it's like everybody's for themselves here, sadly.
Right. And you heard about the new mandate. Everyone needs to wear a mask, right?
Right.
So I hope they're giving out masks in the street.
I hope they give out masks and not just arrest people
and not
or some
harass
stupid
people.
shit or abuse them. Like, give out the mask, y'all. Because not everybody's going to have the mask or not everybody's going to know how to make a mask.
Right. Either
help
way,
people out.
I have links below, too, to help DIY masks, whether from a pillowcase, wear a scarf, just keep yourself safe. Yeah. But I really do hope the city plans on handling it.
It's crazy, like how we went shopping on Wednesday to the supermarket and we were just like so scared. You got to be mentally prepared to go to the supermarket now. That's how freaking crazy. Like, that's how crazy this is because it's like something so simple that you just go and be like, all right, let me go get some cookies or chips. Now it's like scary. It's like you got to mentally prepare and high alert how to go to the supermarket or to the grocery store. And there were people when we were waiting online because now, they let a certain amount of people go to our supermarket across the street. So we wait online. It's not that long, to be honest.
Right.
There was people still out there grouped together with some of them with no mask, some of them with masks. I was like,
yo, if you see your people out there in the street just hanging out with no mask, then you be like, yo, 6 feet.
I don't think because we're very individualism. I think
it's okay.
That's a messed up word. We have the mentality to think about ourselves. Like that was always our thing here. And now we have to think about other people. So it's not about you, it's about everybody else.
Yeah. We're
and keeping everybody safe.
Yeah. So think ahead. But
what is that word?
I do want to
individualism.
You finally got it. Good girl. Anyways, I do want to move on unless you have something else to mention.
Oh!
Yes, the article.
Right. Wait, what article? Oh, yeah. Wait.
Well, we can mention it before we start.
No, hold on.
Yes.
It was because a lot of people are domestic abuse and they have to stay home as well, talking about the child abuse, but now you have domestic abuse as well. And the number is, I wanted to give the hotline number, the National Domestic Violence Hotline. The number is 1-800-799-7233. If you're unable to speak safely, you can log into the hotline.org or text LOVEIS to 22522. And we'll put that in the bottom below.
Yeah.
So you can know. And if you see abuse going on, if you see it, people can call too. Like they could call that number as well.
That's good to know, because
So,
you know I'll be doing that.
You see it.
But we're gonna mention that article right before the movie review. I think that would be cool. I'm just gonna say one more thing about this, unless you want to.
No, go. I was confused for a second.
You want to mention the article now? Yeah, we could.
Oh yeah. Okay, so the article, because we're gonna talk about Crip Camp, and again, we're not people who are disabled, so it's a very like subject that we have to realize that I guess, because we're not people who have disabilities. So we have not lived those experiences. So we're talking out of, we're people who haven't experienced that. I don't know. I'm trying to find the word and I'm like,
more like observers and
yes,
observing their stories.
Yes.
And that's what Crip Camp is about. Mm-hmm. And that's what we're going to review at the end of this.
Right.
But right now we would like to mention
Alex
article.
Alice Wong.
Mm-hmm. Thank you. What's the name of the article?
She's a disabled activist, and she's on YouTube. And Gia Schatz follows her on YouTube, and she brings up all these articles. She has written these articles. The article I'm going to bring up is about how she's disabled and she lives with a ventilator. And she's talking about how like people who are disabled are living during this time of coronavirus. And she talks about eugenics, medical racism, ageism, and ableism. Ableism? Mm-hmm. Ableism, sorry. My words.
You got it.
And she talks about rationing care, which basically, I was reading a medical article about that because she brings that up. It's about basically how these doctors the medical field, the system has to ration out these scarce resources. So basically, what she's saying because she is a person who has disabilities, if she gets coronavirus and she goes to the hospital, they're going to be like, well, why should we try to use our resources that we don't even have enough to use on her, because she's not an able person. She's not an able-bodied person, as they say, a person who's I guess healthy, who doesn't have pain or suffering, a person without disabilities. Maybe that's better, without disabilities. So she was talking about, she was talking about that, and how she was talking about how people look at her in discomfort or pity her in public, and also about how this is going on now about the scarce resources, and how doctors are not looking at them as a quality of life to save. They're just looking at able people to save them, because
and that is so sad.
They don't have disabilities.
That is so sad. It's definitely worth read the article if you can, if you have any interest in this.
Yeah, definitely read the article. We're gonna link it in the bottom, because it was sad. It's terrible what's going on, because you don't even think about that happens with them. She mentioned ageism, because that's what's happening with elderly folks as well. That they're gonna prioritize people who are young, who look healthy, compared to the elderly or the people who have disabilities. They're not going to look at them as oh, should we try to save these people? Because we don't really have much resources. So, and it's evil that that's going on. That these doctors have to make these decisions. It's kind of sad. No, it's not kind of sad. It is sad. It's awful.
Yeah. It's awful.
So sorry, I'm not talking clearly. I'm just trying.
Well, you are.
I'm not trying. Because this is a very important article, and she's an amazing woman. She's Asian American, and and I'm trying to speak clearly about what she's trying to say, but
And you're doing a good job, because this is a topic that we normally don't know much about. So, you know, I mean, we don't know about. So, no, I think you did a great job.
Yeah, so follow her on
But
Twitter.
the article will be down below.
Yeah.
For more
So,
context.
So let's Crip Camp.
Oh, but yes, Crip Camp. Let's
Why
go
are we
into
struggling trying to get to
Crip Camp. Let's keep this moving, and then we'll go into other highlights. But yes, we're not gonna do a real big review. This is like dun, dun, dun. Check it out. Go ahead. Synopsis, real quick.
Oh, damn. Right. I'll give you a shot. I always do the synopsis. For some reason, I'm like blanking out. So basically, Crip Camp is it's a documentary that we didn't see in Sundance, but it actually was shown in Sundance. It's now on Netflix, and finally we got to see it. The funny thing, here's a funny story. I just wanted to bring it up. We were at Sundance to see 2 movies, and one of them was the La Llorona movie, which was really good. We actually have 2 reviews on these 2 films, and the other one is Zola.
Zola, you got it. Yeah, we were on the line with my friend Daniela.
Yeah, I was on the line. We were on the line, and Christy was in the bathroom. We were with Daniela. What's up, Daniela? She's probably working on her homework right now. So we were like on the line, like, yeah, we're gonna see. I think it was Zola that we thought we were gonna see.
No, La Llorona.
La Llorona. My bad. Sorry, this happened in January. And we were like taking pictures, right? Like with our tickets, because we were all like, yay, our first movie in Sundance. We're in Utah. We're in Daniela. We're all excited. Never been to Sundance before, so this is cool. And literally the girl online next to us who was taking the picture was like looking at our tickets like, what the hell?
Yeah.
What line is this? Because she went to her mom was like, what movie are we watching? Because we thought we were watching La Llorona. She was like, oh, excuse me, ladies, I think you're in the wrong line or something like that. Because this is for Crip Camp. And we're like, no.
So y'all run off the line.
So we looked at her ticket and then our ticket, and we were like, oh, we're on the wrong line. We only had
cut to
less than 10 minutes to get to a theater that was, I don't know how many blocks. This is my first time in Utah. It was like 10 blocks or something. And we had to like run out of there. We looked like locals, like crazy people. We just like, we ran in the bathroom like, Christy, we gotta go. We're in the wrong movie theater. It was
what's going on?
bugging out.
I was like, what's happening here?
The crazy shit is we actually got to the movie theater
on time, because if we didn't,
we
would have lost tickets.
Yeah,
$26 for each
$26 tickets.
I think it was 26 or 28, and that's a lot. So we made it.
We made it. It was crazy.
Just to mention, because we were on the line for Crip Camp. I mean, there were so many people to watch Crip Camp, and when I first heard that name, I thought it was a horror film.
She thought it was
Crip Camp, like Crip Keeper. You know what I'm saying?
She's so stupid.
But there was a lot of people, and we're like, oh. Come to find out, it was a really popular film at Sundance.
No.
So we highly recommend it. And why?
Because it's a documentary about a camp called, oh my God, how am I forgetting the name? What's the name again? Jeanette. Oh my God, I'm so sorry.
It's a very unique name. Jeanette.
Jeanette is the camp's name. And I think it was in the Catskills. And it was a camp with people who are a camp for people who have disabilities. So it was in the 60s.
It started in the 50s, but it was in the 70s.
And then the documentary was 1970 and 71, I think, 72. The youth theater who took the documentary. So it was just this amazing camp that all these people who had different disabilities. Sorry, I'm like came together to like be, human beings, to be who they are without people looking like feeling pity for them, not caring for them, just being regular kids, because that's who they are. They were regular kids. They were kids with just disabilities. They were explaining in the documentary how they just wanted to have their independence. They just want to be looked as people and not their disabilities. Their disabilities are part of them, but that's not it doesn't make them who they are. So they just want to look as kids. basically. And that the Jeanette, hope I'm saying it right, the camp, it really grew into all these groups of kids who made a revolution of starting the 50, I think it was 504, right?
504, which is part of a rehabilitation legislation. And that 504 piece in the policy was related to people with disabilities, meaning that they would the federal government would give more funding to places that funded federal, agencies that were funded by the federal government to make their buildings more accessible to people with disabilities. So if that makes sense.
And
but
so, they just became a group fighting for their human basic rights, that they deserved. But of course, this government was not giving it to them. And
you'll see people in there who continue to fight from the 70s all the way until the Disability Act is passed, the ADA, up until the 90s. So you'll see that whole entire trajectory, and it's absolutely amazing, the documentary. Great footage of the camp, which is in black and white also. And you see camp counselors, and also there were camp counselors who had disabilities as well. So that was amazing to see. And then you see their whole advocacy fight, going to DC, staying in buildings, taking over a floor in a building just to get their message
my God,
across.
They were fighters, man. They were these are people who have different disabilities. They were sleeping on floors. They were not eating, and they were still lively. They were there like, we fighting for our rights, man. We ain't going anywhere. And I was amazed by them, because I was like, damn. And I complain about stupid shit, you know. And they were just fighting. They were just going on. They were like, yeah.
There was a piece in the film, too, that they mentioned that they received meals from the Black Panthers.
Yo, that was cool. Like how they were, the Black Panthers gave them food and all that stuff. And how the Black Panthers was like, you guys are fighting for your rights. Like, of course we're going to help you. And that's
what they believed in.
Yeah, that was what they believed in as well. And I thought that was awesome seeing that. What was the act? Was the ADA,
American Disability
Act? With it's 1990, and of course, it's the ramps, when you push the button to open the door, the automatic doors. That was the Disability Act. That
elevators in the trains, now
the subways.
These people were walking up the stairs, pulling their wheelchairs. There's one story of a guy who did that just to go so that he can go to an action. And we were looking at each other like, oh my God.
Yeah, because he was literally, to go to the protest, he literally was going up the stairs, the dirty subway stairs, these stairs in New York City, and pulling his wheelchair up and going up, like, crawling up the stairs. And he still made it, because that's the fighting spirit of like, yo, I'm gonna fight for my rights. I don't care what obstacles in my way.
Right.
I am doing this.
And
that was like, damn.
And there's one mention, like, dirty, you'll learn so much of what they're experiencing. We don't want to share anymore because you just gotta watch it.
Oh, it's an amazing documentary.
You'll learn so much of what their lack of access to before the ADA was passed. And it's just appalling. It's appalling. So, I mean, just watch the documentary. It's amazing. You learn so much about that community.
And how they were just fighting for rights that, we take advantage of. We don't even look at it like, oh, imagine just going places independently without like any help, and having, the able bodies to do it and stuff. And we should have saw that movie or something.
Right, we should
got tickets to that. Yeah. But we finally saw it. It was on Netflix, and it's great. You have to check it out. Oh, you have Netflix. I forgot. Sorry, it was on Netflix. Try see.
That's how good this documentary is.
I don't know. There's 1, 2, 3 movies.
Yeah. But anyways, But moving on, we are trying to keep this in a
I'm
sense,
sure, because
time.
last time we covered a lot.
But
No, check it out.
I do want to highlight an independent film or production company too. Explore the World is on Instagram.
Yes.
Please check them out. They do documentaries. We did a review on a documentary about it's called Pandamundo Around the World.
Yeah,
it's
we have
the
a
Steel
review
Pan movement
on YouTube.
That started in Trinidad. So please watch our review. Watch the film. The film is only like $3.99 to rent. It's very affordable.
It's a really
and they have a new trailer for their new documentary. It's called La Matadoras. It's a film. It's a documentary about female bullfighters. Please check it out. Yes, female bullfighters.
Oh, I'm gonna check that out.
I tried to share the documentary on my
Instagram. I'm hearing this,
but it didn't go because it's really big. So I got to figure that out. Okay. We're still working it out. We'll work something out. But please check out the trailer. It's amazing. And thank you, Shirley,
definitely check that out.
for the article that you did on our show.
It
was absolutely amazing.
Thank you so much, Shirley. Yeah. I've never met you, but thank you.
Don't worry, you will later.
I hope to get to meet you. Yeah. If you are watching or not, but I hope to get to meet you.
And before we go,
the article, it's on fancarpet.com. It's about our show, which is really cool. We'll link it below too. I mean, like, it was kind of a joy to have even during this time. So I really appreciate that she wrote that article about us. And
we were gonna do so let's thank you again, Shirley.
Yeah, thank you.
And Fan Carpet for sharing.
Yeah, and thefancarpet.com. Yeah. Thank you for sharing that as well.
Yeah. We were gonna do Harry Potter Pick Your Quarantine House, but I think I'm gonna save it for the next one. Because you don't have one.
Yes! No, I can pick it fast. Hold on.
No. We're gonna save it for when our Gabriel's on the show. I think it'll be fun too. Don't worry. I'll save it.
I'll save it.
Because I need to post it up too. But anyways, if you didn't get to, we're gonna share it on Instagram and Twitter. Harry Potter Pick Your Quarantine House, just for laughs and giggles and stuff like that. And then I wanna make one last announcement with regards to COVID-19 before we, say goodbye.
I'm gonna talk about this next time because I have to read articles about it. But of course, a lot of the Native American communities, God, I forgot the word, what they're called, that they live in.
I actually don't know.
I know, God, you mean my words, but they're getting hit hard as well, of course, because again, they don't have enough resources.
Right.
So I'm gonna definitely do my research on that, read articles, and bring that up the next show because that's very important as well.
Yeah. And our next show is May 1st. We're gonna be talking. We're gonna have a special guest, Gabriel, again, and we're gonna be doing Kingdom. A review on Kingdom and talk more about everything. But I just want to mention one thing that when I'm gonna keep putting this out there because when the pandemic is over, I really hope that the government remembers all those people out there front lines, people who do deliveries, grocery workers, postal workers, mail couriers, transit workers, domestic workers, farm workers, and anyone who keeps the society going when it comes to anyone. So when it's time for them to vote on legislation that affects their schools, their housing, their health care, their work, paid sick, paid leave, everything.
Vote in November.
Please consider that these people were not only there for the pandemic, but they've been there all through our society, making sure that our society is functioning and equally as important as any capitalist making a lot of money. So don't tell me ain't no money for them or us because we need affordable housing up in here. We
need rent
universal health care. We need more funding for our education, all of that.
Rent freeze right now.
Rent freeze right now. We have city council.
Oh, that NYCHA thing. NYCHA, you're trying to get
there's a rent hardship NYCHA application.
You remember
links are all
that?
below.
It actually finally worked.
Yeah.
The link finally worked.
Yeah, so.
But no, there needs to be a rent freeze, like,
In general,
legit. No.
Yeah, in general. Because there's a lot of people who are essentially.
Because right now, people are like, okay, but then there's people out there who, like, they literally don't have money. Because, again, people live paycheck to paycheck.
Right.
And a lot of people lost, like, 3 jobs in one day.
Exactly.
It's hard, yo.
People working 2 to 3 jobs just to stay afloat. So I have one more thing.
Thanks for watching.
Thanks for watching. Peace out, people.
Peace.
Take care. Stay safe.
Have a great weekend. Is it still a weekend? Today's Friday, right?
Today's Friday.
I know. Yesterday I had such bad depression. I went to sleep the whole day.
Right, and you forgot what day it was.
I literally forgot today was Friday. And I'm like, oh, tomorrow's Saturday?
That's okay, but you're doing good today, right? It's one day at a time. One day at a time. You're doing good right now, though, right? That's okay. That's okay. We can get through this together.
Kind of. I was trying.
But
see, I was trying.
Thank you for watching.
Oh, thanks for watching.
Peace. Get out of here.
Let's keep